So let's talk about ACL tears, or cranial cruciates is what we call it in animals versus ACL in people's. Now we have the same ligaments in our knee. We often get the injuries, basketball players, football players, we do something we shouldn't and we tear a normal ligament. Dogs, it's 50% that, and the other 50% it's actually in their genetics. So they're passed down weaker ligaments. And I say that because what's weaker on one side is likely weaker on the other side. So they do report 50% that tear one side do tear their other knee, most commonly within 1 to 3 years of the first side occurring. So I say that just to primarily watch out for that other side just in case in the future. So we do have the same ligaments in our knee, but we do stand very differently. We stand straight up and down. Dogs stand with all these angles to their leg. So they put way more pressure on that ACL than we ever do. So for them, what's torn is torn. Unfortunately, the ligament actually never really heals. Versus you or I, if we actually have a minor tear, we can put a brace on and immobilize our joint pretty good. That bend with a brace, unfortunately, never lets that ligament truly find itself to really kind of heal across. So if we require surgery, the first thing our doctors want to do is they want to suture our ligament back together. They want to pull our hamstring around and create us a new ligament. I can't do that with these guys. They break all of that back down. That's how much more pressure they put on that ligament than we do. So if all that fails for us, we go off to a total knee replacement. I don't need to go that extensive in these guys, but I do recommend surgery. The surgery that I recommend provides the support of that ligament. So technically, they no longer need their ligament. So the good news there is it's not often an injury they get again because we're providing all the support. Versus you or I, if we actually tear our ligament and suture it back together, we can tear it again in the future. So with that, just to kind of show you and explain on a little bit of a model, knees up here, ankles down here, foot's down here at the bottom. The reason I know that that ligament is torn is not necessarily from your x-rays. Your x-rays lets me know there's a knee problem, but I can't actually see ligaments on here. I see bone really, really good. But what we do see on the x-rays is this is a more normal side knee, this is the abnormal side knee. And on the normal knee, you can see very light gray, triangular, soft tissue kind of fluid buildup in the knee. That's normal. Nice blackened area in the front and your kneecap tendon coming down. Here, you see all that extra lighter gray that's now taking over the darker gray area. That's going to be increased fluid buildup or and joint diffusion in that knee. The other thing we see from here to here is this bone is nice and smooth all around. Where here you're starting to get some sharper points on some areas, it's starting to get more bumpy over the surfaces. That's what arthritis starts to look like. But for you or I, if we're looking at our ligaments, we actually go through an MRI machine to look at those things. I don't necessarily need to do that in the pups. What I often feel on the exam is this. And I shouldn't be able to do that with an intact ligament. The reason the pups don't want to actually put as much weight on this leg is if they're actually putting pressure on the bottom part of that foot when they're walking, that is still shifting forward. So that's what we need to correct in this surgery to give them support so they feel comfortable to walk on that leg again. The other thing I'm going to look at the time of surgery is the meniscus. Now we can tear our meniscus or our ACL, but animals often tear their meniscus because of their ACL, because it's a soft piece of tissue in between these two bones that provides cushion. But as this is happening, that middle and back part are getting rolled over, rolled over, rolled over. That's where the tears usually start to happen. You or I, minor tears we usually suture back together, major tears we remove torn pieces. If I do see any tears in there, I highly recommend removing torn pieces. One, with all this motion, they often tear it worse than we do, plus their meniscuses are much smaller than ours. But if I do suture it back together, there's up to about 30% that are reported to tear it in the future. So with that, if I remove torn pieces, I often do not see them back for another surgery. With that, with the surgery for the ACL, this is the one I recommend. It's called the tibial plateau leveling osteotomy, or TPLO for short. Now there are multiple other surgeries out there, but this is the strongest repair. And with that strength, it's the only one proven 90% successful to get back to running, jumping, playing without any complications. The 10% that do carry some complications, which we'll talk about, but they're the most treatable complications. So what we do in this sort of surgery is we make a semicircular cut into the top part of that tibial bone. After I cut into the bone in that fashion, I rotate that top piece around. What that does is it changes this natural angle dogs have to that top part of their bone, and it flattens it out. It allows this bone to hit this bone a lot more square, down more the axis of that leg. It also relieves the pressure on the front end right where that ACL used to connect. I do need to put an implant very similar to this, plate and screws, to hold these two pieces together to allow them to heal. But now, as you'll notice, when I push up as if we're walking, it's nice and stable. It's no longer shifting forward. Still acts like a knee though, still bends, still moves around, stuff like that. It does take about 2 to 3 months to heal up from this. Your first month's going to be your most critical because there's just not a lot of bone healing yet. So you're really just relying on that implant to kind of hold everything together. So I highly recommend some sort of confined space. How you do that is up to you, whether it's a crate, an area of the house you block off, or a small room with no furniture. But the biggest thing is no running, no jumping, no playing, and no interaction with other animals, unfortunately. Leash walks to go outside to go potties is fine. The first 2 weeks, really try to keep it just long enough for us to do our business, and that's about it. But nice and slow, because the moment we want to actually start putting that leg down and using it some, good sign it's feeling good, plus that's good early therapy these days. Week 3, I actually want you to start working into 5-minute walks, 3 times a day if we can. Where you do that walk's completely up to you, in the house, backyard, actual walk. By the 4th week, I want you to bump that up to 10-minute walks 3 times a day. And then each week from there, I want to keep adding on 5 minutes to the walks every week. That does start their physical therapy. Second month of recovery, we usually see better bone healing, so we want to increase that physical therapy component. And rarely do I need to involve an actual physical therapist unless they're refusing to put weight on that leg. With that, usually by the 2nd month, these guys want to run, jump, and play on you. So you're usually telling them to calm down. But with that, the 2nd month, what I recommend is now whenever you're home, if they're following you through the house, that's great, because it's all about the walking, but still no running, jumping, or playing. So you still have to watch furniture and other animals, but the more they're following you around the house, the better. But again, trying to keep those walks slow enough that we're putting that weight down on that leg at every step. Continue the walks outside like we talked about, increasing them on a weekly basis or going a little further each day, whichever you'd like there. If we usually follow that protocol the 2nd month, by the end of the 2nd month, the bone's usually almost about healed. But the 3rd month's just slowly getting back to normal. So the good news about the 3rd month is we can usually do our normal routine in the house again, get on and off furniture, all that sort of stuff. But all of our outdoor off-leash activities and our play activities, every day we need to do a little bit more, just to build up that muscle strength so it can get back to normal. So hopefully by the end of the 3rd month, usually we're back to doing everything we were doing before. Okay? So like I said, it does have a 90% success rate. Does mean about 10% can carry some complications. But most of those are very minor medical managed situations. Same if you or I had surgery. So there's going to be an incision on the leg. Usually kind of sits on the inside here. So any complications with that incision healing. I don't put a bandage over this leg. You felt how kind of that supported that looked. With that, I do put a little boo-boo band-aid over the incision. But that's only going to protect so much. So I highly recommend, yes, the lovely cone of shame or e-collar, so we're not licking and chewing at it for the first 2 to 3 weeks while this heals up. But the other thing we have that you're more than welcome to purchase is called a lick sleeve. It's almost like a pant leg, goes up around the leg, wraps around the belly, and kind of clips on the side. And some dogs are like, hey, it's out of sight, it's out of mind, they'll leave it alone. And some dogs are like, I don't care what clothing you put on me, I'm going to lick through it, chew through it, I'm going to get it off. Pick what's ever working, okay? With that, the other complication that you'll see is swelling. Swelling will happen around your surgery site. Gravity will often pull it down to the ankle. Doesn't mean anything's wrong with the ankle. Gravity's just doing its job. Just like with you or I, after surgery, the first few days, if you could do some cold compresses to the area, that can really, really help with that swelling. If we are a little overactive, especially those first few weeks of healing, say we get off the leash on you, do some jumping we shouldn't or anything like that, these tissues are rubbing together a little bit more than they should because they're using this leg too much. With that, what happens is the body starts to produce fluid pockets underneath the skin called seromas. Same idea, you kind of rub so much and get like a cyst on your hand. If they get really big, I need to drain them. But to be honest, I rarely have to these days. Because even if you feel like a small one, kind of feel like little water balloons underneath the skin area, do warm compresses. Really helps bring that fluid back into the circulation. So if you can, and you guys will have all these discharge instructions printed out for you, that's not a problem. But I usually recommend the first 3 days of doing cold to the area. The next 3 days I do cold and then I follow by a warm. And then the last 3 days I do warm to the area. And I try to do it 2-3 times a day for about 5 to 15 minutes, depending on what the pets allow. Okay. With that, major complications. Usually report that in about 3 to 5% of patients. And most of those major complications revolve around the hardware. This is unfortunately foreign material to the body. So same thing if you or I ever got metal in our body. Everything that we can get from an implant, so can they. The good news is I don't commonly see the rejection component because we've been using the same material in animals for so long, but it's not to say that it can't happen. But what I do see more commonly in them than us is implant infection. And the most common reason I see an infection is because they often get an infection on the outside for some reason. Most likely their mouth getting to it. So that's why it's very important to keep that area clean and dry and protected. Okay? If an infection does happen on the outside and it travels to this implant, once an infection hits an implant, it'll hide underneath it. It'll wall itself off from the immune system and any antibiotics that it gives. The only way to truly get rid of those infections, same in you or I, is to remove this hardware. But the good news there is once that bone is healed in that new position, that hardware is no longer needed. So as long as we can get the bone to heal, and in most situations we can, take this out, check it for infection, treat that infection and get it out of their system, we can actually still get most of those guys back to normal again. Okay? But 95% of animals usually keep these in lifelong, no problems. I do also have to forewarn you, I have seen implant infections happen years out from surgery, can happen in people and animals. Because the other thing that these guys can sometimes try and do is pull bad infections from other locations in the body. So say we ever get like a bad ear infection, teeth infection, bladder infection, skin infection, treat those things sooner than later. That's what our doctors do with us. If we have implants in our bodies and we get a dental done, they're already putting us on antibiotics just to protect it, okay? But then just always keep an eye on this leg just in case. We start favoring it, limping on it again. We seem bothered by that area after it's all healed up for no reason. Or if you ever notice any bumps, cysts, open areas, pus, discharge, anything like that coming from around the surgery site, then let's take a look at it. Could be coming from that implant. By then, years out, bone should be healed, so it should be safe to remove. We just want to get it out before the infection gets too bad. Okay? But like I said, 95% of animals keep it in lifelong, no